It was pretty haphazard really, so I wasn't collecting feedback routinely. It was informal, so you tend to only get the good feedback.
So as part of doctors' appraisals, we collect feedback every year on paper forms. The questions were very generic and they were often misinterpreted and like a box ticking exercise. The information then went into a spreadsheet which went onto your appraisal but was not available for other patients to see. And the other thing that I used to have was another option for patients to write a testimonial that I could send them a link after clinic. And the issue was that doing that was not very successful in that patients just didn't have enough time, the parents didn't have enough time to fill this out after they had come to see me to help with their child's allergies.
It was pretty clunky, to be honest. We had patient feedback forms at the front desk.
Well, we did use traditional methods, really just a patient questionnaire. So when patients came to the centre after their consultation, they would fill in a fairly simple questionnaire. It was difficult because always the questions were relatively limited and people usually were rushing. They would certainly leave comments, but it's so much better being able to get comments through Doctify. I think they're more accurate and I think they're more reflective and therefore they're more valuable to us and then ultimately to our patients.
It was mainly written feedback. It was very much ad hoc. It was cards. It was sometimes it was champagne.
We actually used a paper-based system initially. It will take a while to process this information.
Right the way back in 2002, we started doing patient satisfaction questionnaires ourselves. We did it all by paper. In those days, it was hardly known about in medicine, and very few people were doing it.
What key frustrations was with Trustpilot was that it wasn't specific around healthcare services in particular.
We base a lot of our service improvement through patient feedback. It's so important. Ultimately, they use our service and they are the service users. So finding an effective way to capture that and integrate that into our improvement plans and quality improvement processes is really important.
I think it's really important. In fact, it's probably one of the most important things we do, because if we don't know and understand what our patients' expectations and requirements are, then it's obviously very difficult sometimes for us to just guess.
I absolutely do. Doing it in an anonymised way is really important. Also, I think it's important for other patients and their families to see what other people say about you, and that gives them more transparency.
From a governance perspective, from a GMC perspective, from a transparency perspective, it's super important to have patient, public engagement and interactivity at the heart of what we do. You know, the whole point about feedback is that you learn and you get better. It's super important to have that sort of feedback, give true quality care to patients.
We're always trying to improve our service. Obviously it's a competitive industry, especially the private industry, so having honest patient feedback is so important. We take as much out of the negatives, of which thankfully there aren't many, as we do out of the positives.
It's a way of knowing that you're offering the right service. If there's any improvements that we need to make, how we can make them. In a time where data is key, I think every clinician should be taking some form of data.
You can't benchmark it if you do your own. And so the obvious way is for patient feedback, because at the end of the day, what we're all here for is to make the patients better. It's one of the most essential things that you can do in medicine.
We're now at that point now where the reviews of patients is probably one of the key decision-making points that patients use in deciding who to go with.
I think it's important for me personally to hear from patients what they found useful from their consultations and the care that I've given them, and the areas where I may not have been aware but that was lacking in some respects. I think it's important for me to be able to get a sort of presence out there or on the internet, but also access what other people think about me and about the care that I've given them. So I think it's really important. And it's really important just in general for doctors to be able to have some sort of feedback mechanism that's in the public domain.
I think Doctify's got to be one of the easiest things I've ever started up. It really has been painless, to say the least.
I must say it was very easy. The process of capturing data, very straightforward.
I found it very easy. Since the new app has been developed, it's been so much easier. I'm able to ask for the review while the patient is in clinic. They remember the experience, so they're able to articulate that very well into the review.
I have found it very easy. They are completely used to this, so they get asked for feedback all the time.
Right from the start, one of the things that we liked about working with Doctify was the ease of working with the team.
The app changed things a lot for me. So using the app and getting the app on a device, on a tablet in the surgery, means that I can just leave it there, and they'll have the consultation, they'll leave, and then they'll go to the office with the secretaries to sort out their investigations or whatever it may be, their follow-up, and the secretaries at the end will prompt them to look at the device and fill out the questions.
I think if they're asked, people will invariably give feedback. I think the only reasons that they won't give feedback is if they're rushing or they no longer have to be concerned or worried about whatever reason it was that they came to the clinic.
The ladies at the front desk are amazing. Patients are easily approachable to do the questionnaire, do the review. So no, it's worked really well.